Health Headlines, the connection between diet and cancer. We've heard a lot about so-called good fats in some diets being beneficial to health. A Yale School of Medicine study reveals that the types of fat consumed are more important than the amount of fat. Here with us live this morning to tell us more is Dr. Mandar Mazumdar, Associate Professor of Genetics and Internal Medicine at Yale School of Medicine. Thank you for your time. Good morning, doctor.
Good morning. Pleasure to be here.
So the thinking has been for us to reduce the total amount of fat to be healthier, but you're telling us this study is proving otherwise. Can you tell us more?
Yeah, we've known for quite some time that obesity is a risk factor for over a dozen cancer types, including pancreatic cancer. And it's been thought that changes in our consumption of various nutrients within our diet, including fats, that have increased over the last 50 years twofold, may be contributing to this rise in cancer development. But it turns out that epidemiologic studies have suggested that total fat consumption is not always linked to increased cancer development. And so we thought perhaps it wasn't total fat, but actually the composition, particular fats in the diet that might play a greater role. So to test this, we developed with our Yale colleagues a high-fat diet panel of over a dozen different diets that differed solely in fat source but had identical carbohydrates and proteins, and fed it to an animal model that mimics pancreatic cancer in humans. That is, the genetic features, the biological behavior, including spread, treatment, and appearance on the microscope. And we found that certain fats within the diets actually enhance the development of disease within these animals, whereas other fats were actually able to suppress it. So polyunsaturated fatty acids, including those found in fish oil and safflower oil, suppress the development of disease in these animals, whereas monounsaturated fatty acids, including those found in olive oil and high oleic safflower and sunflower oils, enhance the development of cancer. So it wasn't really the total fat that they ate, but the types of fat that they ate that mattered.
Okay, so now I do want to, stress this as well, because I'm sure some people hearing this, may say that I need to cut olive oil out. What are we talking? Like how much of something, how much of the fat in olive oil were you studying?
Well, we found that olive oil and the fat that is found enriched in olive oil did increase the development of cancer in these animals. But it's really hard to extrapolate to humans in terms of the amount, precise amounts. I will say that this is early data that suggests, at least in animal models, this is possible, and we need further studies in human populations to determine whether there's actually a causal role. It's also true that olive oil has a number of other health benefits for other diseases, like cardiovascular disease. So while olive oil is very beneficial for heart health, such as those who are at higher risk for it, such as myself as a South Asian, I still use olive oil in my cooking, and I think it's important to continue to use that. But I think our results begin to have a conversation about the possibility of being a little bit more precise and tailored in our nutritional guidance. For those that are higher risk of cardiovascular disease, having olive oil and monounsaturated fatty acid enriched diet seems to be beneficial. But perhaps for those with pancreatic cancer, we need to think twice about that. But I think this is a beginning of the conversation.
Yeah, so how important do you believe the study of our diets and cancer prevention is, for the future?
I get asked a lot by patients and families what it is that we can do to prevent the development of cancers, including things like pancreatic cancer, for which we have a limited number of effective treatment options. And I think having the possibility of tailoring our diets towards a particular prevention strategy in cancer really empowers patients. So I think it does and will play an important role in the future. I think there's a lot more studies that need to be done to really be able to give precise guidance for those who are high risk of cancer.
Very interesting. Thank you so much for joining us, Dr. Mazumdar, and of course for sharing these findings with us.
Thank you for having me.
Of course.